According to the CDC, low back pain is a leading cause for pain and disability in America. But there is hope for people who have been suffering. And here to talk us about the Know Your Back Story. That's right, it's called Know Your Back Story, and it's a campaign and it's available resources. So let's welcome in Dr. Dennis Patterson and his patient, Lee Davis. And let's start with Dr. Patterson first. So, Doctor, this is a common subject, especially among me and my friends. Tell us a little bit more about lumbar spinal stenosis and minimally invasive options to treat it.
Well, thanks for having me today. And yes, this is a topic near and dear to my heart, just like it is with you and your friends. Chronic lower back pain is a huge problem in the United States. 72 million people suffer from it, and 27 million of them never know the cause of their back pain. And we're trying to bring awareness that there is an enlarged ligament in your spine that can lead to pain, or and the condition is actually called lumbar spinal stenosis. And to give you a good visual for it, think of a drinking straw. It's a canal or a tube that's got a wide open canal where your spinal cord and nerves go down it. And as we age, things start to push or encroach on that canal. And once they get to a point where they start to irritate the nerves, we develop chronic back, buttock, and leg pain. And 85% of the patients, it's usually due to this enlarged ligament that we now know how to treat.
I like the way you explain that. Okay, that makes perfect sense. So let's make sense of this. What is the Know Your Back Story campaign?
Oh, it's a national health awareness campaign to bring awareness that this ligament that's enlarged can cause spinal stenosis and pain for patients. And we wanted to know, people to know that there are actually excellent treatment options out there to help them that are really simple and easy to do. The mild procedure that we're doing on patients, they're usually back to normal activities within 24 hours after having the procedure done.
And so, Lee, you recently underwent a procedure to treat your low back pain. Tell us about your experience. How are you feeling?
Well, I feel great. You were talking about you and your friends. I'm sure there are times when you feel like somebody's grabbed you around the waist and they're trying to push you down to the ground. Well, that's a bad feeling to have. Or an elephant leaning against you and you trying to hold his weight off, all that tension and all that pressure. But once I had this procedure done, all that pressure and tension was released, and it just freed my emotion up, and it allowed me to think clearly, because pain, you don't think clearly with pain. But once the pain was gone, hey, a brand new man.
Yeah, you're looking good there, Lee. And yeah, I understand that feeling. Sometimes it feels like an elephant's stretching your back, and it's not a good feeling. So, Dr. Patterson, where can folks go for more? And how can healthcare providers get involved in this important campaign?
Yeah, so I think the public and healthcare providers can go to knowyourbackstory.com. That website has a lot of useful information. Number one, it has a deeper dive into lumbar spinal stenosis, the causes of it, and it also goes further into the treatment options out there, including the mild procedure. The other feature that I love about this website is it has a find a doctor in your area. So if you type in your zip code, it'll give you providers in your area that are familiar with lumbar spinal stenosis and the mild procedure. You can reach out to them, get an appointment, and see if you're a candidate to have the procedure done.
All right, thank you both so much for being on our show. And of course, check it out on our website here, and that is firstcoastliving.net.